Hi, Mandy Friedman here, licensed professional counselor, clinically certified domestic violence counselor, clinically certified trauma professional level 2, creator of SNAP, Survivors of Narcissistic and Abusive Personalities, the owner of Claremont Mental Health. Today I'm here with Leah Abel. We are going to talk about medical trauma. Leah was with me a little while back. We had an episode about medical trauma. What is medical trauma? And we went through that. We promised you that we were going to do another episode that would talk about what you can do about medical trauma and how we can approach that, how we can overcome it. So today we're going to answer the questions, just a little recap on what is medical trauma for those of you that missed that episode. But if you missed it, I think you should go back and listen to it. And then we're going to talk about what particular treatment strategies work to help clients who are dealing with medical trauma. And then Leah is going to give you some little tips for those of you that need to enter back into the medical setting and things you can do to help yourself with that. So welcome, Leah, back to our podcast and to our YouTube channel. And could you just, give everybody a little hello and tell us some things about yourself before we get started?
Yeah, thank you for having me back. My name is Leah. I am currently a student at Xavier University working towards my master's in clinical mental health counseling and interning at Claremont Mental Health under Mandy's supervision. So super excited to be back talking about medical trauma. I have my certificate and training for medical trauma and understanding all the nuances associated with it. It's a topic that I am very passionate about. So I'm excited to continue spreading the word.
So let's define it for those that didn't catch it. What is medical trauma?
Medical trauma is exactly what it sounds like. It is trauma that occurs within a medical setting, to put it pretty loosely. So that can mean a couple of different things. It can mean that you received a life-altering diagnosis. So say you were in a medical setting and you received a cancer diagnosis. That can be traumatic. Say you had a heart attack or some sort of life-threatening incident, a car accident or something like that, that puts you in the ICU. That experience in an ICU can be very traumatic. Or say you have a pretty nasty interaction with a medical professional, a doctor, a nurse, somebody at the help desk. You experience some level of gaslighting associated with what you're feeling, which happens a lot with women in particular. That can be considered medical trauma. I think with any trauma, the moral of the story is if you viewed it as traumatic, then we're going to call it trauma. If it happened in a medical setting, we're going to call it medical trauma. But that's the definition that I would go with.
Excellent. Awesome. Yeah. So it's medical things that happen and then interpersonal things that can happen in the medical setting. So if someone is going to find a therapist that would help them with this, what kind of treatment strategies or treatment approaches would a therapist use in a clinical setting to help someone with their symptoms related to medical trauma?
Yeah, it's a good question. So first and foremost, I think, symptoms to be aware of that you're going to want to be treating in that space. So a lot of the symptoms can feel physical. So you can have the shakiness, you can have the stomach trouble when you're thinking about medical situations. You can have some dissociation when you're thinking about entering back into a medical setting. So those typical symptoms that you experience with trauma and with anxiety are ones that you would be experiencing in this situation as well. So with that said, if you're looking for a therapist to help you, you're going to want somebody that's trauma informed first and foremost. Somebody that understands trauma, somebody that understands how it lives within our body and how it manifests and shows itself in various different ways. When it comes to the actual treatment, some things that come to mind are going to be those more evidence-based treatments. So you're going to want to look for somebody that utilizes CBT or cognitive behavioral therapy. Something that can be really, really helpful in this work is if you find somebody that's trained in EMDR. I have known many people that have utilized EMDR for medical trauma or trauma alike and have seen great success with kind of easing the symptoms and being able to enter back into a world that involves medical treatment. You know, from a symptom perspective, something that can be really helpful is mindfulness work. So a lot of times we're just learning how to ease the symptoms so that we can exist in a world that utilizes medicine. So working on mindfulness, working on grounding techniques, some of those more somatic experiences and learning how to listen to your body and trust your body and calm your body, because that's really the name of the game when you've experienced trauma and you need to integrate back in. I think, you know, one of the really unique things about medical trauma is that you can have a traumatic experience in a medical setting and we still need to utilize medical settings. So, you know, oftentimes we think about trauma in the sense of like, okay, something traumatic happened and I'm just going to avoid that part of my life, which in some cases makes a lot of sense. And those are things that you want to avoid. But we can't do that with medicine. And so we have to figure out how to work with it and how to reintegrate it back into our lives. So a lot of the work that you'll be doing with a therapist is going to involve more of that symptom management to help you reintegrate.
So let's say I'm your client and I need help with that specifically. Because like you said, one of the symptoms would be avoidance and like just not wanting to go into those places anymore. But we can't do that, can we?
No, we cannot.
We can't, and we probably shouldn't either.
Yeah,
because that just compounds the issue further, right? So we're not working to overcome it so then it winds up settling in a little bit, gets your claws in you a little bit deeper if we continue to avoid and not expose yourself to the environment. So if I'm your client and I'm somebody that's been avoiding, and now I realize that it's not good for my health to do that, I really do need to find places that I can go. What kind of tips or strategies would you give me to help me as I'm trying to, you know, I wouldn't even say reintegrate, but maybe just approach a medical setting, maybe approach a new doctor, and then even like going into those first appointments and trying to get settled in with a new setting? What kind of tips would you give me?
That's a good question. So I think first and foremost, we're going to want to make sure that we've got some grounding techniques at the ready. So we want to make sure that we have a handful of breathing exercises that can be utilized on the go in moments where you feel some of that anxiety spike. So whether that's 4-4-4 breathing or box breathing or however we want to phrase it, we want to make sure that we have some of those tools so that, you know, as we enter in and there will be moments where we feel that adrenaline kind of peak, we can pause and we can breathe. The other thing that we want to do is prep. So we want to know when the appointment is. We want to, you know, call ahead and see if there are any papers that we need to have signed, anything done ahead of time. We don't want anything lingering over our heads beforehand. So, you know, call and make sure that you're aware of what's expected of you at this appointment. You can also call and say, what's going to happen at this appointment? You know, it doesn't have to be a secret, right? You're part of this. This is collaborative. So call and find out what's coming so that you can prepare accordingly. You know, if you're somebody that really hates needles and they tell you that this is going to be a situation where they're going to have to draw blood, that's good for us to know, because we're going to want to prepare specifically for the things that are going to be happening in that appointment. The other thing that you want to be mindful of is what external tactile things can help keep you grounded as well. So is music something that's helpful for you? Let's bring some noise canceling headphones in that you can be listening to on your way in the waiting room before your name gets called, with, you know, whether it's music or a mindfulness guided meditation, something that can keep you centered prior to the appointment. And then Clothing, that's another great thing to utilize. Do you like soft fabrics, something that's comfortable, something that doesn't feel constricting in any way? So how can we utilize, parts of your life just to kind of ease that transition in? And then when it comes to the actual appointment, right, the nitty gritty of being in that doctor's office and talking to a professional, one thing I always like to recommend is if there is somebody in your life that you trust and that you love and that is aware of what you've experienced, bring them with you. Oftentimes when we go into these appointments, we do a lot of prep work and then we kind of black out a little bit. And it's hard to remember what the doctor said or what your questions were. So have somebody with you, and before you go in, talk to them about what you want to get out of this appointment, so that if there's a moment where you have a lapse in judgment, they can kind of help guide you through and bring you back to the present. With that, I think also having a list of what you want to get out of the appointment, handwritten or in the notes app on your phone, so that you go into it and you have an awareness of what this appointment is for. And you can even tell, oftentimes there's a nurse that comes in and talks to you before you meet with the doctor. Say to that nurse, I have a list of things that I want to get out of this appointment. Here they are, so that it is in front of everybody. Everybody knows what this appointment is for, and you can say, I'm not planning on leaving until I get these questions answered. So that's part of that prep work, and having your person there with you to help you can be really beneficial. I think asking questions, understanding that the doctor is meant to be there as a partner and not as a superior. So approaching the relationship in that way, understanding that you are the expert on your body, the doctor is not. They are an expert on medicine, which is why you two need to work together in order to treat whatever ailment it is that you're going for. And I think one of the most important things is trusting your gut. So if you go into an appointment and we do all of this prep and you still don't feel good about the interaction you had or about the care that you're receiving, get another opinion, get a third opinion, get a fourth opinion, do whatever you have to do to make sure that you're getting the care that you need and that you deserve under the circumstances. Your gut is your best friend in this situation, and you know yourself and your body best. So that's going to be an important thing to listen to. Those are my tips.
Those are really good tips. Those are great. That's awesome. Yeah. And one of the things we talked about on the previous podcast was that, some people don't have like the luxury of shopping around for a doctor, whether that's because of your insurance or because you don't have insurance. And, ideally, we would want to find care providers that are trauma informed and that we feel comfortable with. However, there could be circumstances in which that, maybe the demeanor of the doctor isn't really something you feel comfortable with. However, we know they're a good doctor.
Mm-hmm.
We know that they do know about the topic that you're there for, but they don't have the bedside manner that you would prefer. So that might take you, really challenging yourself to overcome that. I just don't like them, but okay, I don't like that part. It's not that they're harmful. It's not that they're gaslighting. It's just they're not the style that you really would like, but they're doing a decent job of being the medical professional in the room. I think that might be one of the more challenging situations because, well, like my son, for example, there's a doctor that his father really doesn't like, but I really think is good. And it's a interpersonal thing, like it's a personality thing where, my son's dad just doesn't like that the doctor kind of treats him like he's a regular old person, like he doesn't do the whole, I don't know what you would call it, like butt kissing type things. It's more like, I think I mentioned, like, he comes in and instead of saying, so, is your son still taking this? Is your son taking this? He'll say, so what is your son taking? That feels really intimidating. And it almost feels like, well, why are you questioning me like this? But you know what else it does? It makes me get really responsible for and hold myself accountable for learning how to pronounce the medications, knowing when they're given and why they're given. So it's like he quizzes me and says, when's he taking it? How much is he taking it? And I'm like, it's the pink one. It's the and then I can't pronounce it. And then he'll say it. And then he has me say it. I appreciated that, even though it was uncomfortable. Other people might not have the best response to that, right? So I think navigating those moments too, where it's like, I need this care. I think that this is an okay place to have it. It's just, I don't like this person and I don't like being here. How do I force myself to go along with this? Luckily, in that situation, it's my son. And he's fine. He's totally fine. He's not picking up on any of the stuff that, I am. He's having and doctor's a great doctor. It's all good. So yeah, I think for me, if I'm speaking for myself as your client, if it was going to be a problem, that would be the problem at this stage of the game is, okay, I've detected if it's like flat out not okay. And I've also detected what I would really love to have, but my resources are not allowing me to get there. And now what do I do? I think those tips that you gave were really, would be very effective for all of the situations that somebody might wind up in: the grounding, the mindfulness, the preparing, the creating the list. And the list is even something that's kind of neurobiological. That's the thing about the grounding strategies and the mindfulness, is that it switches us from the trauma brain to the logical, rational brain. So when you write that list down, or when you write the answers down, oh, hold on. And, you ask the question, oh, now you're writing down the answer. That keeps you in the prefrontal cortex, keeps you more grounded. And then having the other person there with you, so that if you get off track, they can get you back on track. Excellent. Well, I'm going to use these strategies, Leah. Next time I go into an uncomfortable medical situation, I'm going to remember what you suggested, and I'm going to use those tips. So thanks so much.
Of course. Thank you for having me to talk about this.
We'll do another episode of medical trauma topics. Maybe we'll get into some more specifics as we go. But I really appreciate your time and doing this with me. I know it's not like the most fun thing to make a video.
Depends on who you're asking. I'm having a great time.
Good. All right. Me too. Me too. Well, we'll do it again. All right, everybody. I hope this has been helpful. Bye-bye.